Circumcision generates over $2 billion annually for the American medical industry, making it one of the most profitable unnecessary procedures in healthcare. Peer-reviewed research shows women rate intact sexual partners 8.03 versus circumcised partners 1.81 on a 10-point pleasure scale, while European countries with predominantly intact populations have lower STI rates than circumcised America. Yet 71% of American boys undergo this procedure based on medical claims the rest of the developed world considers fraudulent. Circumcision has ancient religious origins in Judaism and Islam, practiced for thousands of years with zero medical justification, purely as religious obedience to Bronze Age texts commanding permanent body modification of infants. For millennia, billions of children have undergone irreversible genital surgery based solely on ancient religious authority, not medical necessity. American medical circumcision represents the hijacking of this ancient religious practice, transforming religious compliance into medical necessity through 19th century Christian moral panic. What began as pure religious control over children's bodies was repackaged as healthcare to expand the practice beyond religious communities. The transformation began in the 1800s when European doctors theorized that removing the foreskin would make the child more morally hygienic. This wasn't medical science, it was Christian sexual suppression attempting to expand a purely religious practice into general medical policy. By the early 1900s, American medicine had fully adopted circumcision not for religious reasons, but as a cure for masturbation, which Victorian doctors believed caused everything from blindness to insanity. Dr. John Harvey Kellogg, the cereal inventor, was a leading advocate for circumcision specifically to reduce sexual pleasure. In his 1888 work, Plain Facts for Old and Young, Kellogg wrote that circumcision should be performed especially in cases where masturbation is practiced. Kellogg recommended the procedure be performed without anesthetic, as the brief pain attending the operation will have a salutary effect upon the mind. The goal wasn't health, it was sexual suppression through deliberate trauma and pleasure reduction. By the 1950s, American medicine had completely medicalized what began as Christian hysteria. Doctors promoted circumcision as cleaner and healthier. Modern research confirms what Kellogg intended. Circumcision significantly reduces sexual pleasure. A study published in PubMed found that masturbatory pleasure decreased after circumcision in 48% of the respondents, while only 8% reported increased pleasure. The foreskin contains specialized nerve endings and represents at least a third of the pineal skin, according to research published in the British Journal of Urology. The foreskin increases sexual pleasure by sliding up and down on the shaft, stimulating the glands by alternately covering and exposing it. Research published in the Circumcision Resource Center notes that without the foreskin, the gland's skin, which is normally moist mucous membrane, becomes dry and thickens considerably in response to continued exposure. This change reduces its sensitivity. The procedure literally desensitizes permanently. The research on female partners is even more shocking. A medical journal survey of women with comparative sexual experience found they rated genitally intact men 8.03 and circumcised men 1.81 on a 10-point scale. Women reported being about twice as likely to experience orgasm if the male partner had a foreskin, according to research published in peer-reviewed medical literature. With circumcised partners, women were significantly more likely to have experienced vaginal dryness during intercourse. The mechanism is clear. The foreskin glides up and down the penile shaft, reducing friction and retaining vaginal secretions. Without the foreskin, the skin on the penile shaft rubs against the vaginal wall, resulting in friction and increasing the need for artificial lubrication. The cleanliness justification is perhaps the biggest medical fraud. European countries where most men remain intact have lower STI rates than circumcised America. In Northern and Western Europe, rates of HIV are lower than they are in the US, despite the fact that most American men are circumcised and most European men are not. Studies show that persistent infections are often caused by the overuse of soap rather than the foreskin itself. Research published in medical journals found that men with recurrent infections reported significantly more frequent daily washing with soap, creating irritation, not preventing it. The American medical industry generates over $2 billion annually from circumcision procedures, with individual procedures costing $1,500 to $3,000. This creates massive financial incentives to maintain practices that the rest of the medical world considers unnecessary. Unlike genuine medical procedures, circumcision is almost always performed on healthy infants with no medical indication. It's elective surgery marketed as preventive medicine to create revenue from unnecessary procedures on the most vulnerable patients. The profit motive explains why American medicine clings to practices abandoned by European medicine. When a procedure generates billions in revenue, medical organizations have financial incentives to maintain recommendations regardless of evidence. The global medical consensus opposes routine infant circumcision. European medical organizations state there is no medical justification for routine circumcision of infant boys. This confirms what history shows. Circumcision never had medical justification. The British Medical Association notes that the medical benefits previously claimed have not been convincingly demonstrated, while Canadian and Australian medical organizations have moved away from recommending routine circumcision based on current evidence. This suggests financial rather than medical motivations drive American recommendations, attempting to medicalize what remains fundamentally a religious practice with no legitimate medical foundation. Circumcision represents one of the most successful transformations of religious practice into medical industry profit. What began as ancient spiritual covenant became Christian anti-masturbation hysteria, then evolved into a multi-billion-dollar medical business built on debunked health claims. The research consistently shows that intact men and their partners experience better sexual function, while international evidence demonstrates that intact populations have better health outcomes than circumcised populations. This video respects religious and cultural choices while presenting medical evidence. For those making this decision, consult healthcare providers and consider that the rest of the developed world's medical consensus differs significantly from American recommendations.